So this is the second antibiotic for today, the cephalosporin. So cephalosporin we use or indication of cephalosporin are gram-negative bacteria. So gram-negative bacterial infection, if anybody have gram-negative bacterial infection, we use the cephalosporin, or if anybody has a gonorrhea, we use the cephalosporin. If anybody has a very bad pneumonia, we use the cephalosporin. Or if anybody has a UTI, means urinary tract infection, we should use the cephalosporin. The cephalosporin we do not use if anybody has a allergy to cephalosporin or allergy to the penicillin, right? What are the drugs name we use for the cephalosporin? The most common drugs we use for as a cephalosporin are cefazolin, or cephalexin, or ceftriaxone. Usually we use 1 gram injectable form ceftriaxone in case of any very bad gram-negative bacterial infection. Other name of cephalosporin, other medication of cephalosporin are cefoxime or cefadoxime or ceftriaxone, right? Easy way to remember, most of cephalosporin started with CEF, like cefoxime, cefazolin, or ceftriaxone or cefazolin, right? So as I told you, the cephalosporin or all of these drugs we use for bacterial infection. So it is antibacterial medication or antibiotic. The mode of action of cephalosporin, they weakening the bacterial cell wall and causing the bacterial cell death. What are the side effects of cephalosporin? Cephalosporin can cause GI upset, means diarrhea, nausea, vomiting. Same like penicillin, they also cause GI upset. Cephalosporin can cause allergic reaction. Same as penicillin can cause allergic reaction. Allergic reaction means patient develop the dyspnea, means shortness of breath or difficulties of breath or skin rash. Sometimes cephalosporin can cause the superinfection. Superinfection means yeast infection or fungi infection of candidiasis, develop the very bad fungi infection or candida infection. They are superinfection. Superinfection means you taking the cephalosporin for any other bacterial infection, but the body is immunosuppressed and developed other infection like candida infection or yeast infection, like this, right? And here we said the other side effect of cephalosporin can cause the furry tongue. Furry tongue means blackening in the tongue, furry tongue. So here we go. And also, if your patient take the cephalosporin, always make sure the liver function test is important. The cephalosporin sometimes cause hyperglycemia. The side effect of cephalosporin can cause hyperglycemia, means blood sugar go up, or develop the anaphylactic shock because of allergic reaction, or insufficient platelet count, and it is called thrombocytopenia developed, or cephalosporin can cause the renal infection, means nephrotoxicity. If anybody has a overdose of cephalosporin, we has to give them anti or antidote, and this is called epinephrine, same as penicillin. If anybody has a penicillin overdose, we give them antidote, and this is called epinephrine. Both antidote are same, epinephrine. So the key point for cephalosporin, if you give your patient cephalosporin as a RN, you have to know, do not give to the patient with a history of allergy to cephalosporin or allergy to penicillin, and do not consume alcohol during the cephalosporin therapy. And also you have to keep in mind, cephalosporin is work better if you take with food, or cephalosporin should take with food. This is very important information regarding cephalosporin.